You may not realize this, and Terry, but nearly 3 million Americans are affected by epilepsy.
And while medications and other treatments may help, many patients continue to have seizures that can sometimes severely limit their school achievements, employment prospects, and maybe even participation in life's full experiences.
And so we wanted to learn a little more about epilepsy. Today, Dr. Nikesh Ardeshna from Spectrum Health Medical Group is here. And tell us a little bit about epilepsy. Many people know the word, but they don't really know what it is.
Sure. So epilepsy is basically a medical disorder that puts a person at risk for having unprovoked seizures. So a person can have a single seizure, but when they're diagnosed as having epilepsy when they've had one or more, so basically a second unprovoked seizure. And they have a risk basically at any time they can have a breakthrough seizure, even amongst some of the best treatments that they're getting right now.
Okay, so we talk about seizure. In our minds, we think of that just violent shaking, the grand mal kind of seizure, but are there different levels of intensity with those seizures?
You're correct. I think the better way to put it, and you're 100% on, it's more there are different types of seizures and they present in different ways. What you and I see most often and what patients tell me is we saw the patient fall to the ground, they were shaking, which is commonly referred to as a grand mal seizure, but is that the only type? No. Seizures can present with abnormal speech, numbness, tingling, abnormal movements, and as you said, you know, the hard part for people also to figure out is where's the seizure coming from? But seizures and epilepsy are really from an electrical disturbance in the brain. So that's why it's so hard to diagnose it, and because they present in so many different ways, sometimes the diagnosis is delayed.
So as common as epilepsy is, I've never witnessed a seizure myself, and I know there are probably a lot of people who can relate.
Yes.
What do you do to react if you do one day see someone having a seizure?
And chances are you're probably going to see somebody having a seizure. Maybe your friend, maybe your family, but you're correct. It is, but the best answer to that is really, first of all, don't panic, okay? Be very reassuring, okay? Try to ease the patient to the ground if they're standing, okay? Don't hold them. Don't keep their mouth open or pry their mouth open, because it can cause an injury to the person who's having the seizure or to you who's trying to help. And you want to turn them to their side so that it's easier for them to breathe. Try to put something soft under their head. Move any sharp objects or anything out of the way if possible, and you let the seizure pass. Most seizures end, the grand mal type seizures, like you were saying, end in about 2 to 3 minutes, okay? But be very calm and reassuring, okay? And really, the other thing to realize is that for those patients who have seizures out there, they should have knowledge of first aid, just like you and I just talked about, and also for their friends and family to know, as you were asking appropriately, what to do if they have a seizure.
So who's at risk? If you grew up and had a fairly normal childhood and you're very healthy, is there a chance later in life maybe you could start to have symptoms?
Yes. It's actually the most common thought people always think is, because why do I have seizures now? Seizures can begin at any age and any time, and you don't have to have a family history, or you don't even have to have any risk factors, such as you didn't have to have seizures as a child, you didn't have any major head injuries, and what you had asked about was who was at risk, and clearly now what we're seeing is that the fastest growing segment of the population is actually seniors with new onset epilepsy. Yeah.
Wow. You know, why is it? How can something manifest itself for so long without being apparent in a very visible way, as seizures are?
And nobody has a great answer to that one. We're thinking it is basically something to do at the level of the brain and the electrical circuitry, so that could manifest at any time, as you said. But the real reason why we're seeing it more in seniors is because the fastest growing segment of the population with seizures before was actually children. Now it's seniors, one, because we're living longer. 2, a lot of the things that predispose to a seizure we see more in seniors, like certain head traumas or head injuries, strokes, brain tumors, Alzheimer's disease. But the unique thing, as you said appropriately, is sometimes none of those exist and a person can still develop seizures. And this presents for you, me, everybody, a huge educational opportunity.
Well, and we really appreciate you being here with us today to share the information with our A-West viewers. We're really blessed here in West Michigan to have such talented, what's the word for your specific discipline?
The specialty is, I'm an epileptologist,
okay.
But epilepsy doctors are basically the ones who are the most specialized in taking care of patients who have seizures. And what we advocate for you, me, any age of patient, be it a child or an adult, is to get to see that specialist as soon as possible so that they can get the appropriate treatment and they can live a healthy and productive life as many patients with epilepsy can. And we all have a blessed team here, actually an enlarging team as well, a very multidisciplinary team that helps me out in taking care of patients.
Yeah. Fantastic. So if you have any questions, contact Dr. Ardeshna, and we really appreciate you coming
and
on
thank
the
you
show.
for having me.
We'll be right back.
That's West.